clear that over the last 20 or 30 or 40 years, that disparities in health have been widening across the world. And that is paralleled by the disparities in wealth across the world. Now, there's a very clear relationship between wealth and health, although it's not a linear relationship, and it's not an absolute relationship. But in the face of severe poverty, health is seriously compromised. And I think the structure of the global political economy is in many ways a description of the enslavement of people in permanent poverty, which means that the opportunities for children to be born into a world where their prospects of them surviving childhood and having a decent education and becoming the kinds of responsible citizens and workers that the world need is being undermined for a very large proportion of the world's population. Those of us who are privileged and who are enjoying all the benefits of what the modern world offers tend not to see that as clearly as we should. But we represent only about a fifth of the world's whole population. Living in South Africa, I see the enormous deprivation, and I see the gaps in wealth and health that have grown since even the new government came into power. And I understand that the future of our nation will be determined not by political power, but by narrowing the economic disparities. Because 25 years ago, we faced the possibility of a civil war over political power. The moment we are facing the possibility of civil war over resources, because the rich have got very, very rich, including the black elite, and the poor are not only very, very poor, but perhaps poorer than they were during the apartheid era. And in many ways, that's mirrored across the world. South Africa is a microcosm of the world, and in many ways, South Africa shows the very worst of the world as well as the very best of the world. So I'm concerned that in my own society, I'm seeing the signs of serious fracturing of the potential for what the new South Africa offered. And I see that as a reflection of what's happening elsewhere, not least in America. A debate that has raged in South Africa intermittently over many decades is whether there should be universal access to healthcare or whether the healthcare services should be, to a considerable extent, privatized. And for whatever reasons, when we moved into the new South Africa, some of the ideals that the ANC had in their Freedom Charter and the idea of greater equity within the country and the idea of universal access to healthcare that they and many of us argued for very strongly, in a sense gave way to the thrust from the private sector. So that very much has followed the American model rather than the model of universalized access to healthcare elsewhere. And the reshaping of the healthcare system in South Africa, even within the public sector where it had to be reshaped, hasn't been as successful as it could be. There has been an emphasis on primary care, but it hasn't worked well. Partly resource issues, partly the tensions between the private and the public sectors, and partly the fact that despite the fact that we are a new so-called human rights-oriented democracy, that the lives of some are not worth what the lives of others are worth. And that's an undermining aspect of our society, which I think is also reflected in your own society. I suppose I've been very influenced by the fact that I had a chronic disease since childhood. So in addition to being a medical practitioner, I've been a patient. And I've been able to witness what medicine means from the perspective of a patient as well as from the perspective of a deliverer of healthcare. And it's clear to me that the vulnerability of human beings and the extent to which we need to be not only taken cared for, but cared for, gives the doctor a very important role in society. So the idea of what it means to practice medicine, the idea of what controls medicine, what the values are within the healthcare system, to me seem to be central to what a health professional is about. And the more medicine becomes commercialized, despite the many advantages that brings, and the more we become oriented towards just this individual in front of us without concerns for the broader population health, the less modern medical practice becomes connected to the common needs of the society. Everything begins with ideas. If you've got a good idea and you work on the idea and there's good scholarly work done in the field, things change. I think the debate between paternalism and autonomy and patients' rights and narrowing the power gap in medicine, one of the big thrusts of bioethics over the last 20, 30 years has been successful. I think it's changed people's attitudes, not always for the best, but I think there have been some very significant advances that have been made. If I look at the field that I've been involved in, research ethics, wealthy researchers coming into developing countries didn't understand anything about the people or the countries when they began to come. There's a slightly better understanding now of the responsibilities of doing research in developing countries. So I think there's evidence of moral progress in terms of the understanding. To translate that into actual practice is more difficult because of the rules and regulations of funding agencies like the NIH. But again, I think that bioethics needs to expand into the ethics of institutions. How do our hospitals work? How do our health insurance companies work? Whose benefit are they there for? How can they sustain the good workers within those systems more effectively than they do? And so that extension into the field of institutional ethics and the role of institutions together with the role of individual practitioners trying to practice high quality patient care, to me it's an opening field. Public health ethics is growing, nice literature in that field, but not enough yet. And the next step is to go to the ethics of international relationships. What governs the resources of the world? What determines whether people will remain reasonably well-to-do or terribly poor? To what extent can resources be extracted from the poor in a manner that is not acknowledged to be harmful to them? I think those are burning issues that need to be debated by scholars, and hopefully those ideas will then have attraction with the public and change the way we perceive ourselves and what the future might look like. Is the realism of the world where military might and control of weapons and war, is that going to dominate forever, or will we understand that there are limits to what can be achieved through military might? What about the might of the mind? What about the might of knowledge? What about the might of doing the right things? Could those things become powerful in addition to other things? And who's going to advance that debate if it isn't thoughtful people examining what medicine's about and what life's about and what the future of our countries might be?